I'm Jim Bussel. I'm an emeritus professor of hematology at Weill Cornell Medicine in New York, New York. And my entire work has focused very heavily on ITP. I did my first trial in ITP starting in October 2nd, 1981. The major unmet need in adult and pediatric ITP is complicated, several parts. One part of the unmet need, addressing fatigue and quality of life issues, which often are ignored in treatment studies or assessments. Second unmet need is being able to do something curative without having a lot of side effects. Third unmet need is failing getting a curative thing, having a way to maintain patients with no restrictions at all that works in the great majority of cases. And even though it seems to outsiders as if that's been achieved, that's not necessarily been achieved for many patients. So fostamatinib is a new treatment, and what's exciting about it is it has a new mechanism of effect. It blocks a Syk inhibitor. Overall, the response rate that could be considered clinically meaningful was over 40%, and this was seen in two parallel randomized studies in the patients who were on placebo entering the long-term extension study when they started active drug, and back from the published study in 2009 that looked at 16 patients. So generally good, generally sustained responses, not the highest response rate in the world, some minor side effects. Generally, long-term use of romiplostim in adults and children is very safe. Adults, there's a 6% rate of thrombosis compared to maybe an approximately 3% background rate, so an increase perhaps 3% rate. In children, thrombosis has really not been an issue. The study in general showed amazingly good long-term efficacy in these difficult patients. 90% reached a count greater than 50, 72% reached a count greater than 50, 75% of the time, and 58% achieved a count greater than 50 on 90% of measurements. I don't think ICON 1 really looked at necessarily the most effective agents. It was exploring which ones were used, why were the choices made, how did they affect the patients. So I don't think you could look at it as a true efficacy study. It definitely looked at quality of life, for example, in rituximab patients that had never really been looked at very well before, certainly not prospectively. And it showed how people chose treatments. And I think the future ICON study that potentially would look at eltrombopag up front in children in a randomized study will be very informative and very good. Well, we anticipate it'll be very effective, and since ITP in children tends to go away, it might be very, very steroid sparing. What's exciting also is that there will be genetic studies of DNA and RNA accompanying it, and even studies of what happens to iron, since we know that eltrombopag is an iron chelator and can contribute to iron deficiency in children, and that may or may not relate to efficacy. At this meeting, two oral thrombopoietic agents that had been previously investigated and then dropped for various reasons re-emerged. One is lusitrombopag from Shionogi, the other is avatrombopag from Dova Pharmaceuticals. Those agents in pre-procedurally for patients with liver disease, and in the case of avatrombopag for ITP, as expected, had very, very good results and seemed to be quite safe, and they may find important room in the ITP space going forward. because of their lack of dietary restrictions.